Hello again, YouTubers. It's Simply Sharita, and I wanted to take a minute really quick to touch base with y'all because I'm also a recent graduate from nursing school for my associate's degree. I'm an LPN, been one for 16 years. Graduated last Friday, yay, for my associates. So now I'm awaiting my authorization to test for the NCLEX. But I wanted to give some nursing tips for school for nursing students because I know even as an LPN going into RN school, going into clinicals, going back into school, it was stressful and you're like, what should I expect? So with that being said, the best thing I can tell you is to definitely take really good notes from your professors. I felt like in nursing school, they weren't giving you anything. Like our instructors for exams, they don't round up because they tell you basically you better know it frontwards and backwards. And the NCLEX doesn't round up. So if you were taking classes before and they gave you like a point here and there because whatever reason everybody missed the question in class, that's great if your instructors round it up. It's fine and dandy on prereqs. But when you get into nursing school, some instructors don't do that. Now, granted, we did have like one instructor who did. Now that's out of like all the nursing program. So I'm just saying, like, prepare yourself to know the material. And when I say know it frontwards and backwards. Also, again, I said take good notes. My next thing that I would recommend is finding your personal study pattern. Not what Susie Q does, not what John Doe does. You have to do what works for you. I mean, and it may change, like from what you did in high school or what you did in any previous college class. For me personally, when I was in LPN school, flashcards were my savior. I mean, I used flashcards through every class. It helped me. Loved them, swore by them. For some reason, I don't know why. I don't know if it's because I had kids this time around and I was just really busy. Flashcards were time consuming because it was just too much material to be making flashcards for. And then I felt like it was better if I wrote the material. So for me, what I found worked for me was I literally would go back and I would write the whole lecture, everything, write the whole thing. Because for me, when I'm doing flashcards, I'm getting bored. I'm not really paying attention. But when I'm writing, you're having to look at the material to write it, to know it. So for me, that was a big help. And I will highly recommend that because you were writing it. And then once you wrote all your lectures, then you go back and, of course, you study them. But for me, I felt like writing them was everything. So that might be helpful for you. Also, and I started actually doing that in microbiology. That's when I learned, like, this is what works for me. So I recommend you try what you'd like. I mean, if flashcards work for you, yay. But if they don't and you're stressing out because it's like, how am I going to learn all this? Try writing it out. Because when I would write it out, I would also highlight like different colors, like ulcerative colitis would be in blue, esophageal varices would be in yellow. So I almost would like remember that when I'm taking a test and like thinking it out and thinking about what went under what. So whatever works for you. I'm visual and that helped me. So just a little tip there. Another tip for clinicals, sorry about that. For clinicals, always be prepared. That is huge. Always be prepared and looking for things to do. Your instructors are watching you. They're watching you and they're talking to the nurses that you're precepting with. Believe me when I say that. Just because you think, oh, she didn't talk to her today. She might talk to her when you guys leave. When you guys get on the elevator to go to home, she's going back and talking to your nurses to say, how did they do today? So, I mean, yeah, and, you know, some of the nurses are really nice. Maybe some of them aren't. But at the end of the day, do what you're supposed to do. Follow the rules. If you're not sure about something, ask your instructor and always refer back to your school policy. Our school was really strict about blood products. We were not allowed to touch them, do anything with them. So just know your school policies along with the actual hospital policies, because your school may not allow student nurses to do something that regular RNs would be able to, and if you do it, you're in trouble. So be careful with that as well. Also for clinicals, I don't know how, other people's programs are, but we had to have everything. That's why I say be prepared. Have your stethoscope, hemostats, pen light, notebook, your pens, just anything you might possibly need to assess the patient. Because if you're not prepared, it's a bad look. And again, they will say something, the nurse you're precepting with, to your instructor, whether you know it or not. So, talked about notes, talked about clinicals, exams. So for people who don't have any experience in the medical field, your exams in nursing school are going to be like a whirlwind for you, because they're not going to be like, how many chambers does the heart have? It's not going to be like black or white. It's going to be 4 answers. 2 are going to be, you can rule them out. And then 2 answers, you're going to be like, these are both good. I could use both of them. But they want the best answer. So the more you can start getting yourself into that routine, the better you will be. Trust me on that. So just start practicing. There's all kinds of things out there. There's all kinds of resources. There's like the NCLEX Mastery app I personally have on my phone. I'm using it right now to study for my NCLEX. I'll let y'all know how my NCLEX goes after I take it soon. So I highly recommend that app, though, even in nursing school, like whatever, if you're a freshman in nursing school, I think it's great to use because it has every category: med surg, pharmacology, OB, pediatrics, just so many. And it tells you like what percentage you're getting right. It gives you the rationales. I ended up paying full price because I didn't get it at a discounted time, but $30 for basically unlimited access. So you pay a one-time $30 fee, and at the time, believe me, I know you're nursing students, the struggle is real, but I can tell you it's the best $30 that you'll spend, because it's one time, and then you have like over 1,000 questions you have access to, and the more you do them, the better you get at them, the better it's going to help you prepare for your nursing exams as well. And I felt it was great. We actually had a pharmacology test my senior year, and some people didn't pass it. I felt pretty confident going into it, but I can tell you that I did use my NCLEX Mastery app, and they actually have where you can break down the category and just do questions in that section. And I just did pharmacology, and I rocked my pharmacology exam. I think I made like an 88, which was really good because most of the class made like a 80 or below. So I was feeling pretty good. Any questions specifically about nursing school, hit me up. I will tell you I did the Hearst review today, and I did it. It's a 3-day live review. That's what I just did, and I think it was definitely worth the money. It's $300+. It is expensive, but you want to take your NCLEX one time and be done. So I might make another video on the Hearst review on my opinion on that, but briefly I will tell you I think it's worth the money, and I think that if you do what they tell you to do, you'll be successful. That's my feelings on it. Again, I'll keep you posted. Any questions, hit me up in the comments. I'll be glad to answer them. Thank you for watching. Have a blessed night.